1 in every 8 babies born in the United States will be born prematurely. That is more than 500,000 babies annually. November is Prematurity Awareness Month, and in honor of this, Terrebonne General Medical Center would like to discuss ways to keep mom and baby healthy throughout pregnancy and delivery.
All right, joining us now, Laura Poole and Dr. Channing Sanders. Welcome to the program. We appreciate you being here.
Thank you, Mark.
Thank you.
All right, first question to you, Doc. What does it mean for a baby to be premature? Basic question for you.
Basically, a premature baby is pretty easy to define because it's just a baby that is less than 37 weeks and 0 days, according to whatever dating criteria we use to establish their due date. So essentially, if they get a due date of a certain date, it's 3 weeks prior to that.
Okay. What are the causes? What causes a baby to be premature?
Well, the exact cause of preterm labor is not really known at this time. It never really has been, but there's a lot of factors that have come into play with reasons that people may have preterm labor that eventually leads to the birth of the baby. So the most common thing that's really been a real common thing that's come along lately as far as prematurity would be multiple births, and that has a lot to do with a lot of infertility procedures that are being done now, and we see a lot more incidences of twins, triplets, and for the most part, that's about the most multiples that we sort of experience in these areas. Most people don't end up with quadruplets or quintuplets anymore.
Okay, and we do have some more factors that we're going to bring up right now. If you could continue to educate our audience and myself on it.
Yeah, the other things that may lead to some preterm labor have to do with mainly maternal problems such as diabetes, whether it's either insulin requiring or just diet controlled, heart disease with the mother. Probably one of the most common reasons would be infection, urinary tract infections or just typically bladder infections, or if they were to progress to a kidney infection. Especially in that instance, when you run in fever and you get really hydrated and stuff, you can end up starting to have contractions, and if it goes untreated, it'll progress to preterm labor, which could lead to delivery. So usually if somebody has that kind of infection, we have to get them admitted to the hospital, treat them with IV hydration, antibiotics, things of that nature, and try and make sure they do not go into preterm labor. And then other chronic conditions of the mother would be mainly like kidney disease and stuff like that. Anything that would be something that they would be sick with even if they were not pregnant.
Now, as we move into problems during pregnancy that may increase the chance of premature births, that would include?
One of the most common things would be the cervical incompetence or insufficiency of the cervix. Probably the next, also another real common thing would just be a history of preterm delivery. For whatever reason, it does seem that if somebody's had a preterm delivery and they get pregnant again, they do have an incidence of having premature birth more than just a person that's had a term baby before. Birth defects in the uterus, such as anomalies that make the uterus distorted or not big enough to actually hold the baby in, can do this. And then also just not proper eating habits during pregnancy and not taking care of yourself during pregnancy can also be associated with that.
Okay, and then of course a big word for you right there, for me anyway, you've seen it before.
Right, well preeclampsia, well there's several other things that are problems like that can sort of develop during pregnancy. Preeclampsia is one of the most common things that happens in pregnancy. It's where they have high blood pressure, some swelling, some protein in the urine, and then they'll either develop into preterm labor or we'll have to deliver them prematurely because the preeclampsia is so severe. Another thing that has to do with infection, similar to urinary tract infections, would be premature rupture of the membranes where the so-called water bag would break, and usually within 24 to 48 hours they would end up going into labor on average.
Okay, and we have some other factors that can be a cause of prematurity, and they are, once again?
Yeah, these are pretty common things, and this is why prenatal care is stressed. A lack of prenatal care or not seeing a physician while you're pregnant typically will lead to The other risk factors that are associated with that, which is either a young female, which would be less than 16, having a low socioeconomic status, or the use of tobacco, cocaine, amphetamines, or any other drugs. So when somebody has prenatal care in general, we can monitor most of that and try and keep them out of the so-called trouble that's associated with those and not lead to preterm labor.
All right, we're going to take a break. When we come back, we'll be back with Laura Poole and Dr. Sanders. Don't go away.
Terrebonne General and Mary Bird Perkins Cancer Center bring a new standard of high-quality, comprehensive cancer treatment to our community. Now in one convenient location in Houma, bringing together world-class technology and a caring and healing environment to provide the best patient experience possible. Our new cancer center was built for you because we care for you. Mary Bird Perkins Cancer Center at TGMC, Houma.
I'm a director here at the Little Theater in Houma. Sometimes I've acted, and I've even played in the orchestra. My name is Karen Schilling, and I was treated for breast cancer at Mary Bird Perkins at TGMC. Quality medical care and compassion should go hand in hand, and I definitely got that at Mary Bird Perkins Cancer Center. My doctors were incredible, and the technology is state-of-the-art. I believe that everyone at Mary Bird Perkins at TGMC deserves a standing ovation.
All right, we're back. Once again, our guests are Laura Poole, Director of Women's Services at Terrebonne General Medical Center, and Dr. Channing Sanders, OB/GYN doctor at Terrebonne General. Thanks for being back. We appreciate it.
Thank you.
All right, let's talk about complications, Doc, to premature birth. What would that include?
Yeah, mainly this boils down to just a couple things. Preterm babies have a higher instances of having neonatal jaundice, where they'll turn yellow and have problems with bilirubin. They have problems with breathing, where they'll have to be on some kind of support. They can have problems with their bowel, where they'll have inability to digest food, and then they'll have mainly some problems with anemia and stuff like that.
Okay, now we want to hear from Laura. We were ready for you, Laura. Okay, the physical characteristics that would be specific to premature babies, what would they be?
Well, they're much smaller in size.
Right.
They don't have as much fat tissue when they're born. They don't have as much hair. They don't have as much, just basically their overall appearance just isn't as developed as a term baby. And because their skin is so thin, it's difficult sometimes to keep them warm, and we have to manage them with additional equipment. They have problems with breathing, and like Dr. Sanders mentioned, they sometimes have to be on support, like a ventilator. So those are all, characteristics that we traditionally see. They struggle with maintaining normal blood sugars because we can't feed them, so it's just, it tends to pose some various challenges.
What are the red flags, Laura? Any red flags or warning signs that you see prior to this?
Well, if a mom is having any contractions like 10 minutes apart, or if she has, several contractions within an hour, or if she has the leakage of fluid from the vaginal area, or if she has any change in discharge that she may experience that's not out of the routine of what she normally is experiencing. Sometimes they'll have menstrual-like cramps. We often hear that preterm labor cramps or contractions are very different from term cramps. So sometimes we'll find with moms coming in is they'll complain that they feel like they're having menstrual cramps, but they don't really feel like they're in labor, but sometimes they are. So it's a different complaints that the moms will have, and sometimes it's because they're so mild or not to what we characteristically think. They may not pay as close attention as they should, but we encourage our moms, if they experience any of these problems, that they need to come to the hospital or contact their OB/GYN physician to be evaluated.
Dr. Sanders, any kind of treatments that would prevent premature labor from starting or continuing?
Yeah, I think the key is probably just early recognition of somebody having preterm contractions, which is basically the same thing. They just haven't had any cervical dilatation at this point. And if you can get on that pretty quick and treat them with IV fluids and be a little bit aggressive about that, that'll help. Then once they do develop into preterm labor, if they show up in preterm labor, then we usually use mainly 3 modes of treatment, which include either a shot just below the skin, we have some IV medicines that we'll give them, and then there is a pill that you can take by mouth. So depending on how dilated they are, how early they are, and how aggressive we want to be, we decide upon the treatment based on that.
All right, to both of you, Terrebonne General was recently recognized for participation in Department of Health and Hospitals Birth Outcomes Initiative. Who wants to take the lead on that? That was a pretty good award there. Laura, you want to start with that?
Well, the whole state has really been focused on, less than 39-week deliveries that don't have a medical indication. And it was just basically to look at, reducing the number of NICU admissions throughout the state, and looking at just, obstetrics traditionally has not been an area that we've looked at quality indicators. I mean, we hear a lot of that in a lot of the services. So it was basically to look at patient safety and the quality of care that's being provided. And so we were one of 20 hospitals throughout the state that do births that were actually awarded. And it's a joint effort that Terrebonne General and the physicians have been working toward over the last several months. And and it's something that everybody's really excited about, and it's just really made us look at how we do things.
And Dr. Sanders, that's got to make you feel pretty good.
Yeah, it does. It's a little bit of a challenge because the average amount of time that people think that they should deliver a baby in general, with the study that was done, was around 36 to 37 weeks. So part of the education process of trying to make people understand that they have to wait longer will be something that we'll go through over the next year, trying to establish that 39 weeks is when we know that the baby's lungs are mature. There are a lot of other reasons that we may have to deliver babies prior to that, but it'll all be based on what we believe is happening with the patient and whether we think the delivery is indicated at that time. So, we do have a little bit of problems with it. People sometimes will come in and they're not quite used to that, and they think they should deliver earlier, and we just have to let them know that that's not necessarily the case at this time.
Patience, huh?
Yes, yeah, it's hard to be.
Laura, the name is blanking me right now. What was the name of the recognition of the award?
It was entitled the Perinatal Quality Pioneer Award.
Okay.
For the Department of Health and Hospitals.
Very good. Congratulations to both of you.
We were very surprised and excited. It was very unexpected.
That's good when you get it, then you can whoop it up a little bit and sort of be proud.
Yes,
and enjoy the moment. That's fantastic. How do people watching learn more about premature births? Who can they contact?
Well, of course, they can always contact their physician and basically, have any discussions as far as any signs or symptoms that they're having, or they can call the hospital at 873-4141. We also have classes they can enroll in. So, we give a lot of information out, and I know our physicians definitely give a lot of information out. So, but if they have questions or concerns related to that, then they can always give us a call.
And they can go online at TGMC.com. So thank you both for being here. We appreciate it, and congratulations on the award.
Appreciate it.
And we'll take a break. When we come back, we'll be back with more right here on Bayou Time. Don't go away.